Differential diagnosis of hypertension and their clinical features. Hypertension, or high blood pressure, is a common medical condition that affects millions of people worldwide. Primary hypertension, it is the most common type, accounting for 95% of cases. It develops gradually over time and most cases are asymptomatic and are diagnosed incidentally on blood pressure recording or measurement. Risk factors include age, obesity, smoking, family history, and a diet high in salt and saturated fat. Clinical features may include headaches, dizziness, fatigue, and blurred vision. Physical examination may be unyielding. Secondary hypertension is high blood pressure that is caused by another condition or disease. Secondary hypertension is less common, accounting for 5% of cases. Clinical features may include symptoms related to the underlying condition. Presentations that should raise suspicion of secondary hypertension include early onset, severe or resistant hypertension. A suggestive family history or clinical clues can point to a specific secondary cause. Some common causes of secondary hypertension include kidney disease. Any injury to the kidney or arteries that are too narrow can lead to poor blood supply to the organ. This can trigger higher production of a hormone called renin. Renin leads to production of substances in the body, like the protein molecule angiotensin II, that can raise blood pressure. The clinical features of kidney disease in hypertension may include loss of appetite, nausea, vomiting, drowsiness, feeling tired or sleep problems, shortness of breath, edema starting in face, headaches or trouble concentrating, increased or decreased urination, generalized itching or numbness, dry skin or darkened skin, weight loss and muscle cramps along with resistant hypertension. However, many patients with kidney disease may not have any clinical symptoms and the condition is often detected incidentally through routine evaluation or unrelated disorder tests. Adrenal disease, located on top of the kidneys, the adrenal glands produce and regulate hormones. When there is a problem with these glands, hormones in the body can become unbalanced and cause several conditions. These conditions can include pheochromocytoma, a tumor of the adrenal gland that overproduces epinephrine and norepinephrine near the fight-or-flight hormones. Symptoms of pheochromocytoma are episodic and include headaches, sweating, rapid heartbeat or tachycardia, high blood pressure, tremors, palpitations, anxiety or nervousness, weight loss. Primary aldosteronism, a condition where the body makes too much of the salt-retaining hormone aldosterone. More common in women than in men, and it most commonly occurs between ages 30 and 50. Some of the clinical features are excessive thirst, increased urinary frequency, nocturia, or the need to urinate during the night, muscle cramps, weakness or tingling, dizziness. Cushing's syndrome, a condition where there is too much of the hormone cortisol, a regulator of carbohydrate metabolism and blood pressure. Common signs and symptoms of Cushing's syndrome include weight gain and fatty tissue deposits, particularly around the midsection and upper back, in the face, moon face, and between the shoulders, buffalo hump. Pink or purple stretch marks, striae, on the skin of the abdomen, thighs, breasts, and arms. Thinning, fragile skin that bruises easily. Excess hair growth, hirsutism, and irregular menstrual periods in women. Erectile dysfunction and decreased fertility in men. High blood pressure and blood sugar levels. Mood swings, irritability, and anxiety. Weakness and fatigue. Osteoporosis and bone fractures. Hyperparathyroidism, in this condition, the parathyroid glands, located in the neck, overproduce hormones that regulate calcium levels in the blood, and this condition may lead to high blood pressure. If you have mild hyperparathyroidism, you may experience symptoms such as weakness, fatigue, depression, and bone pain. If your hyperparathyroidism is more severe, you may have symptoms such as frequent urination, abdominal pain, nausea and vomiting, constipation, loss of appetite, confusion or impaired thinking, fatigue, muscle weakness, joint pain, depression. Other problems associated with severe hyperparathyroidism include reduced kidney function, which affects your kidney's ability to filter blood, and high blood pressure. Thyroid problems. Both hypothyroidism and hyperthyroidism may lead to high blood pressure. Hypothyroidism symptoms commonly associated with hypothyroidism include weight gain, fatigue, poor concentration, depression, diffuse muscle pain, menstrual irregularities, constipation, cold intolerance, dry skin, proximal muscle weakness, and hair thinning or os. Bradycardia, elevated diastolic blood pressure and narrowed pulse pressure may be observed on examination. Hyperthyroidism. Clinical features of hyperthyroidism include losing weight without trying, fast heartbeat, a condition called tachycardia, irregular heartbeat, also called arrhythmia, pounding of the heart, sometimes called heart palpitations, increased hunger, heat intolerance, tremors, anxiety, insomnia, diarrhea, muscle weakness, menstrual irregularities, changes in vision, swelling at the base of the neck. Coarctation of the aorta. This condition involves tightening of the aorta, the main artery on the left side of the heart. Coarctation restricts normal blood flow. Older children or adults present with upper extremity hypertension, leading to early coronary artery disease, aortic aneurysm, and cerebrovascular disease. High blood pressure in the arms and upper body, but low blood pressure in the legs and lower body. Differences in pulse when measured at the neck versus the groin. Radiofemoral delay. A distinctive, harsh heart murmur may be heard on the back in the interscapular region. Obstructive sleep apnea. In this condition, a person is awakened frequently from sleep and has pauses in breathing during sleep due to collapsed passages in the upper airways. Symptoms include excessive daytime sleepiness, loud snoring, observed episodes of stopped breathing during sleep, abrupt awakenings accompanied by gasping or choking, awakening with a dry mouth or sore throat, morning headache, difficulty concentrating during the day. Side effects from certain medications can also contribute to secondary hypertension. Medications like symptotomimetics, amphetamine derivatives, oral contraceptives, etc. can raise blood pressure, causing secondary hypertension. It is essential to identify the underlying cause of secondary hypertension, since it will be tough to control until those conditions are addressed. The more resistant the hypertension, the more likely there is to be a secondary cause.